new strain of potentially deadly superbug has broken out in the Flinders Medical Centre.
Over 100 patients were exposed to a potentially deadly
Sounding the alarm about nightmare superbugs in our hospitals, now in 42 states, highly contagious, deadly, and drug-resistant.
Antibiotic resistance happens when bacteria change to protect themselves from an antibiotic. They are then no longer sensitive to that antibiotic, and when this happens, antibiotics that previously would have killed the bacteria or stopped them from multiplying and no longer work. This is currently a global issue that affects many people. Superbugs. They are various strains of infection that cause bacteria to become resistant to antibiotics. In early 1930s, before the creation of antibiotics, doctors had a small amount of drugs to select from to relieve the symptoms of patients, and these were ineffective for bacterial infections. There was a breakthrough in the 1930s where sulfonamides were the first antibiotic. In 1940 to 1960, there was an antibiotic revolution of sulfur drugs, which were a major breakthrough, but penicillin was considered as a phenomenon as it's mass-produced in the mid-1940s. Penicillin was a major step in the medical industry as it was capable of treating what was once a severe disease. During the late 1940s, bacteria developed more and more. Stronger antibiotics were made as penicillin wasn't responding to some infections. A strain of staph known as MRSA, methicillin-resistant Staphylococcus aureus, and this is a serious health problem today.
After the superbug outbreak, many patients have come into my clinic asking what the superbug is all about. Bacteria carries genes that allows them to survive exposure to antibiotics we currently have. This means that infections caused by these bacteria are harder to treat, although they are not necessarily more severe or infectious. What is concerning is that the gene that carries antibiotic resistance that can be passed between bacteria, allowing for the creation of bacteria to carry resistance. According to some studies, the CDC says that approximately 40 to 50% of those infected may die. So, what is the symptoms of a superbug? These include high temperatures of above 38 degrees, chills, feeling unwell, dizziness, confusion, muscle aches and pains, swelling and tenderness in the affected body part.
The rise of antibiotics resistance has become an increasing concern for scientists around the world. The resistance developed over time is due to doctors unnecessarily prescribing antibiotics and patients not completing the correct dose. The more antibiotics used, the more chance of bacteria becoming resistant to them. There are many superbugs which have evolved and currently existing, and just to name a few, methicillin-resistant Staphylococcus aureus, which is one of the more common bacteria which does not respond to methicillin antibiotics no longer. Tuberculosis is another one which was once a disease curable with antibiotics and now gradually becoming resistant to many drugs. E. coli and Salmonella are foodborne bacteria and increasingly becoming resistant to drugs as well. So superbugs which are gradually becoming resistant to antibiotics is because of mutations occurring in their genes after becoming in contact with antibiotics. So therefore in time, these resistant bacteria pass on their genes to other bacteria through contact, therefore forming a new strain of antibiotic resistance. So basically ways to block off these harmful bacteria are to make sure you wash your hands with soapy water often, and if you are sick, make sure your doctor understands your symptoms and doesn't just prescribe you with antibiotics.
Herbal medicine have been used for thousands of years as antimicrobials and yet remain effective until today. Therefore, it's highly recommended that herbal medicine is promoted to the general public more effectively and frequently. It is also important that doctors prescribe herbal medicine to patients instead of drugs. Herbal medicine is built to use of plants and herbs as simple as garlic or cranberry to treat diseases and enhance well-being. There are various mechanisms in which herbal medicine exert antimicrobial effect. These include phytochemical attack on the bacterial cell wall, inhibition of enzymes generated by bacteria for the deactivation of antibiotics, disabling the efflux pumping system developed by bacteria to prevent antibiotics penetrating into the bacteria. In most cases, common illnesses and diseases such as sore throats, Superficial wounds, sinus problems, and urinary tract infections do not require antibiotics. They can be effectively treated through maintaining a proper diet, good hygiene, and undergoing exercise, as well as expert botanical medicine care by trained herbalists. In the long term, this can lead to prevention of the misuse or overuse of medication.